Hello student, myself Yoshi Patel. In previous video we learned about some instrument and their uses in the surgical procedure, and today we will discuss about nasal speculum and tongue depressor as well as their types and uses in the examination and surgical procedure.
Nasal speculum used for examination of the nasal cavity. There are so many types of the nasal speculum available in hospital. First, Tudicum nasal speculum. Second, St. Clair Thompson nasal speculum. Third, Killian nasal speculum. Fourth, Hartmann Helle nasal speculum. Fifth, Cotal nasal speculum. Thudicum nasal speculum. Thudical nasal speculum having two blades as per the patient requirement. Used different type of the blade like small, medium and large. Available size 0 to 8. Let's see uses of Thudicum nasal speculum. It is routinely used in diagnostic and therapeutic nasal procedure like anterior rhinoscopy. Rhinoscopy means visualization of nasal cavity for foreign body removal. Then nasal packing and surgeries of nasal septum. Secondly, St. Clair Thompson nasal speculum. It has a long blade as compared to Tudicum nasal speculum. Therefore, it is mainly used for the posterior rhinoscopy, means posterior visualization of the nasal cavity. There are uses of St. Clair Thompson nasal speculum. It is a stainless steel instrument which have long blade as compared to Tudicum nasal speculum. Therefore, it is used for the posterior rhinoscopy and removal of foreign body from nasal cavity. Third, Killian nasal speculum. You can see in the figure how to examine nasal cavity through the Killian nasal speculum. Killian nasal speculum having two long blade and having screw for the fixation. See, there are uses of Killian nasal speculum. This is a self-retaining nasal speculum. Blades of different size and difference between blades can be adjusted and fixed with a screw. Used for anterior rhinoscopy and removal of foreign bodies. In the surgical procedure like polypectomy means removal of polyps and septoplasty. Then fourth, Hartmann Helle nasal speculum. You can see this instrument in the picture. Uses of Hartmann Helle nasal speculum. It is a useful tool in endoscopic nasal procedures. The Hartmann Helle nasal speculum is useful for retracting nasal walls and inspecting nasal passageways. Fifth one is Cotal nasal speculum. Cotal nasal speculum is made up of stainless steel material. It has a screw for to fix the blade in the nasal cavity. There are uses of Cotal nasal speculum. It helps in providing internal visualization of nasal wall. This speculum is designed for endoscopic nasal procedure. The very thin, narrow and tapering blade of Cotal nasal speculum are used for retracting the nasal walls, thus allowing visualization of narrow nasal passages. Now we will discuss about tongue depressor. Tongue depressor, which are mainly used for examination of tongue and oral cavity. There are types of the tongue depressor. First, S-shaped tongue depressor. Second, legs tongue depressor. Third, wooden tongue depressor. It is also known disposable tongue depressor. This tongue depressor has slightly S-shaped. Therefore, we can see S-shaped tongue depressor. This tongue depressor, also called spatula, it is a tool used in medical practice to depress the tongue to allow for examination of the mouth and throat. Second, Lake's tongue depressor. It is also known as a L-shaped tongue depressor. In that wider blade, you can see in the picture, wider blade inserted into the oral cavity and another side small curved for the better grip. There are the uses of the Legs tongue depressor. Examination of the oral cavity like vestibule, buccal mucosa, gums, floor of the mouth, and examination of the oropharynx and posterior pharyngeal wall. Third one is wooden tongue depressor. It is made up of wooden material and it is a single used tongue depressor. There are uses of wooden tongue depressor. There are flat, thin wooden blades which are rounded at both ends, disposed after single use, and used in the medical practice to depress the tongue to allow the examination of the mouth and throat.